not feeling secure, they tend to narrow their vision, and they tend to say, okay, there's a little bit of a problem, there's insecurity, I have to focus on my own family, I have to focus on myself, right? But of course, if everybody thinks like that, then the situation for the poor gets worse.
Yeah.
So, in a sense, we have to emphasize the opposite, namely to say, look, you feel insecure, you feel, no, you can understand what it is like to live in Africa, and when something bad happens, for example, grandma gets sick, or there's no rain one year, what happens then is not that you live on 500 euros a month unemployment benefits. What happens there is you die, or your child dies. So the insecurity that you feel here now in Spain is an insecurity that is still very comfortable compared to the insecurity that many other people in the world have to experience. And so you should use the opportunity to try to empathize with people who are much worse off than yourself. So what we need in the world as it is, a world that is fluid, unpredictable, and in which we all can suffer sudden catastrophe, like 9/11, or all sorts of things can happen. Now Japan had a terrible disaster with the nuclear power plant.
Even in
right?
Spain yesterday.
Yeah, in Spain there was an earthquake, I know. So the thing is that these things can happen to any one of us, and in order to be safer, we have to be more willing to be solidaric. We have to be more willing to give. And also, this is just what human beings are like or should be like, right? I mean, what a species are we if we always sort of pull back and say, oh, I have to look after myself, my biggest duty is to myself, to make myself comfortable and so on. What a species are we? We are not like that. Human beings can do better than that. And so I think, especially in situations of insecurity, we have to learn to collaborate, to work together, to practice solidarity, and we'll all be much safer.
So I said it was my last question, but now it's my last question. So do you have any suggestion for a medicine faculty in order to improve this solidarity aim?
Yeah, I think you're already beginning to do that. I just talked with the people who run the medical school, and I think this is just terrific, the idea to de-emphasize or emphasize less all the learning of knowledge, and to emphasize more that medicine is a service profession. We have a responsibility. We are dealing with patients. We have to understand holistically not just the patient's body, the molecules, but also the mind and the social context in which patients live. We have to understand the whole family, not just the person before us. So all these things are definitely important. And I think also that almost everybody who studies medicine does it because they want to help. It's a calling. It's not, medicine is not like fixing cars or fixing computers or something. It's something that people really feel deeply committed to. Most people, not exactly everybody, but almost everybody. And you can build on that and really emphasize the ethos of the doctor and say, this is what it's like to be a doctor. It is first and foremost, it is a calling, a responsibility, a way of life, an ethos. And then secondarily, of course, it's a competence, an expertise where you can help people. But the second without the first is really quite worthless. And also ineffective, much less effective than if you feel sympathy and solidarity with your patients, and if you understand your patients as human beings in their social context.
Okay, so thank you very much. It was
Pleasure.
very interesting, and I'm looking forward to hear you in the conference then. Thank you.